Imagine waking up to find that the medicine your child needs is suddenly nowhere to be found. Not because of a factory fire. Not due to a natural disaster. But because of a political decision made in the middle of the night. This is no dystopian story, this is America in 2025. Overnight, what seemed unthinkable became reality. Parents are scrambling from pharmacy to pharmacy in search of basic medications. Nurses are turning patients away because supplies have run out. Emergency rooms, once bustling with resources, are now operating like war zones, short-staffed, under-equipped, and overwhelmed. Over 270 million Americans now face potential disruptions in medical care. Pharmacies are emptying. Hospitals are rationing. Critical care units are running on fumes. And it all started with a tariff, one that turned healthcare into a weapon and patients into collateral damage. Before we dive into the shocking details, take a moment to like this video, subscribe to the channel, and tap the notification bell so you never miss a story that impacts your life. What you're about to hear isn't just about politics, it's about survival. The 250% tariff that shook the nation. President Trump announced a sweeping 250% tariff on pharmaceutical imports from what he labeled non-cooperative nations. The list included Canada, Germany, India, and even long-standing allies like France and the UK. The reasoning: national security and trade realignment. The impact: immediate and devastating. The markets didn't even have time to react before shelves were cleared. Importers halted orders. Freight companies backed away from contracts. Millions of units of life-saving medication were stuck at ports or never shipped at all. Clinics and hospitals couldn't restock critical supplies. This wasn't just an economic decision, it was a direct strike on the foundation of the U.S. health system. The ripple effects began to disrupt everything from emergency rooms to nursing homes within hours. Emergency drug shortages in the heartland. Pharmacies in Alabama, Kentucky, and Idaho were among the first to sound the alarm. Basic medications like insulin, antibiotics, blood pressure pills, and even aspirin began vanishing from shelves. Panic buying by concerned families only accelerated the shortages. /n. In Kentucky, one rural pharmacist reported having just 3 insulin pens left, and dozens of diabetic patients needing daily doses. In Idaho, a children's hospital halted elective surgeries due to a shortage of anesthesia. In Alabama, dialysis centers reduced operating hours as saline solution became scarce. Nurses started rationing what little supplies were left, while doctors made impossible choices about who would get treatment. These aren't inconveniences. They are life-threatening emergencies. The silent collapse of Canada's $3 billion medicine pipeline. Canada has always been a reliable pharmaceutical partner. Each year, over $3 billion worth of medical supplies and drugs flow south into the U.S. quietly, efficiently, and without drama. But not this time. Canadian Finance Minister Mark Carney, known for his calm demeanor and strategic mind, made a bold move. In response to Trump's tariffs, Carney halted all pharmaceutical exports to the United States. No fanfare. No grandstanding. Just a quiet executive order that stopped the supply chain cold. Hospitals in the northern U.S. felt the impact first. States like Michigan, Vermont, and Minnesota, which relied heavily on Canadian exports, saw their inventories dry up within days. Cancer treatments, for antibiotics, and surgical tools stopped flowing. Wall Street in shock, a market in free fall. The financial markets responded in panic. Wall Street took its biggest one-day hit since the early days of the COVID-19 pandemic. Pharma stocks like Pfizer, Moderna, and Johnson & Johnson plummeted. Pfizer, in particular, froze its $800 million expansion plan in Michigan, citing regulatory chaos and unpredictable trade enforcement. Biotech startups saw billions wiped from their valuations overnight. Investment into healthcare innovation paused. Even non-pharma tech companies, such as Amazon and Apple, saw their health tech branches stall as access to imported devices and materials dried up. Venture capital firms immediately pulled back funding, fearing more volatility. Pension funds and institutional investors scrambled to shift assets, further destabilizing the already fragile market. A global fallout. Who sounds the alarm? The World Health Organization issued a red-level alert. Officials warned that the ripple effects of the U.S. tariffs would soon reach the poorest and most vulnerable nations. Countries like Bangladesh, Kenya, and Haiti rely on US-facilitated pharmaceutical shipments. With those routes blocked or under-resourced, global health could deteriorate rapidly. Already, field hospitals in Kenya reported delaying malaria treatments. In Bangladesh, aid agencies were forced to cut rations of HIV medication. Clinics in refugee zones also began reporting dwindling vaccine stock. This is no longer a US story, it's a global crisis with far-reaching consequences for humanitarian health infrastructure. Europe fights back through legal channels. In Brussels, the European Union wasted no time. Legal teams filed a formal complaint at the World Trade Organization, accusing the US of violating global trade laws and weaponizing medicine. In a rare show of unity, even nations often at odds with one another backed the motion. French President Emmanuel Macron and German Chancellor Annalena Baerbock called the tariff a betrayal of international trust and human rights. Trade ministers across Europe met in an emergency summit to coordinate responses. Ideas floated included pharmaceutical embargoes, retaliatory tariffs, and rerouting medical innovation away from US markets. Some even proposed an EU-led initiative to establish independent medical supply chains free from US influence, marking a serious shift in global pharmaceutical alliances. Trump's trade for security swap, the political gamble. Trump stood firm, calling the move a trade for security swap. He argued that America can't afford to rely on foreign nations for critical resources like medicine. If they want our cooperation, they need to play by our rules, he declared at a rally in Ohio. But critics say he's turning healthcare into a political weapon. They argue that while national security is important, endangering lives to make a point is reckless at best, and criminal at worst. Public health experts warn that this type of policy sets a dangerous precedent, where essential goods become leverage in ideological battles, rather than a guaranteed right. Governors revolt, states sue the federal government. Across the country, governors from both red and blue states are uniting in an unprecedented lawsuit against the White House. A coalition of 16 states filed a joint complaint, accusing the Trump administration of violating public health protections and abusing trade authority. Governor Andy Beshear of Kentucky spoke at a press conference, "We're being forced to choose between following federal law and saving lives. We choose life." The lawsuit is gaining traction in federal courts, with some judges hinting at the possibility of emergency injunctions to restore certain supply lines. Civil rights attorneys have also joined the case, arguing that this federal overreach infringes on states' constitutional authority to protect their own citizens. Carney's calm but crushing counterstrike. While Trump plays loud politics, Carney plays quiet chess. His retaliatory strategy wasn't just about blocking medicines, it was about forcing the US to realize how deeply it depends on international goodwill. Canada has since redirected shipments originally bound for the US to countries like Australia, New Zealand, and the UK. American buyers are now competing with overseas governments for basic supplies and losing. Economists point out that this redirection doesn't just affect availability, it inflates prices dramatically. Even generic medications have doubled or tripled in cost, putting additional pressure on low-income families and already strained healthcare systems. Trust erodes at every level of the system. The most damaging outcome of all may not be the missing medicines. It's the collapse of trust. Patients no longer trust pharmacies to deliver. Doctors are frustrated with hospital administrators. Governors can't rely on federal leadership. And on the global stage, America is no longer seen as a stable partner. This erosion of trust could take years to rebuild. And in the meantime, the system is vulnerable to misinformation, to chaos, and to further political manipulation. Healthcare workers warn that burnout is growing, patient panic is rising, and local clinics are being overwhelmed by people desperate for alternatives or answers that simply don't exist. What happens next? A health system on the brink. America's healthcare system is already fragile. It has survived pandemics, labor shortages, and rising costs. But this is something different. This is self-inflicted damage on a national scale. With politics dictating who gets treatment and who doesn't, the nation is entering a new era. One where families are told there's no chemotherapy available. Where seniors wait weeks for blood pressure medicine. Where a child with asthma can't get an inhaler because of a tariff. This isn't just a trade war anymore. It's a healthcare war. How is this crisis affecting your area? Are you seeing empty shelves or delayed treatments? Let us know in the comments. Your stories matter, and sharing them helps others understand the real cost of political decisions. Don't forget to like, subscribe, and hit the bell so you stay informed. The situation is evolving fast, and we'll be covering every step of it right here on the channel. Stay safe. Stay informed. And speak up before silence costs even more lives.